I'm Dr. David Thomas. I'm a practicing psychotherapist in Tampa, Florida with Whitford Thomas Group to speak to you today about ADHD. ADHD is attention deficit hyperactivity disorder. Really comes in two different areas here. If you split it in the middle there, attention deficit. Now, attention deficit is just kind of how it's described, is an inattentiveness. The other piece, the hyperactivity, is really associated more with behavior and an area of impulsivity. ADHD is normally or usually diagnosed with people or children ages 7 and above. Adults also experience attention deficit and oftentimes are not diagnosed but still display a lot of the symptoms post 18 years old. When we look at attention deficit, the inattentiveness, some of the characteristics of that or some of the symptoms that we look at are, one, just the inability to attend to various stimuli. Certainly with young people, it may come out in the area of difficulty following orders, taking instructions, a lot of carelessness. Also, when we look at inattentiveness, the ability to stay on task, to stay focused. Oftentimes with test taking, it becomes very difficult sitting for prolonged periods of time. When you're looking at the other side of attention deficit hyperactivity is the behavior of hyperactivity. And this oftentimes you'll see in a young person's or an adult's difficulty in sitting still. Oftentimes with younger folks, what you see is especially young kids, they tend to kind of get up and move around a lot, which normally isn't a problem unless everybody else around them are kind of listening, staying quiet, kind of playing games and things of that sort. So the hyperactivity piece comes a lot in the fidgetiness and things of that sort. But they're both pieces, the inattentiveness as well as the hyperactivity. I'm Dr. David Thomas, speaking to you about attention deficit hyperactivity disorder.